Hi, Miss Seneca. How are you?
I'm good. How are you?
I'm good. My name is Taya. I'm going to be the nurse talking to you about your discharge teaching plan today. Is that all right?
Yeah, for sure.
Awesome. So I know you came to the hospital a couple of days ago for your appendectomy surgery, and you're still here because you've acquired pneumonia while being here. So today we're going to be talking about ways to prevent your peers from getting it when you go out into the community or when you're at home, as well about ways to manage your illness as well, so you have a speedy recovery. So to begin, what is your preferred way of learning?
I prefer learning with one-on-one discussions as well as a visual guide.
Awesome. So I also have some pamphlets that I'm going to give you at the end of our discussion that you can go home with, and I'm also going to explain everything. So also, what do you feel like is your main learning need while being here?
Well, because I came to the hospital for my appendectomy surgery, I didn't really expect to acquire pneumonia.
Yeah.
So, do you think you can tell me more about what pneumonia is and how I can prevent my friends and family from getting it? Because I'm unfamiliar with this infection. But I am familiar with the symptoms that I do have. So I'm having difficulty breathing, terrible cough, as well as sputum that's yellowish brown in color.
Okay, well, all of the symptoms you're experiencing are normal with pneumonia. It's just a part of the infection. But what it actually is an infection in your lungs, and it causes inflammation in the air sacs known as alveoli. And so it can be triggered by toxic agents like toxic gases or infectious organisms such as bacteria, viruses, or fungi. So what we're going to discuss is how we can get you better as soon as possible. Does that sound good?
Sounds great.
Awesome. So when you go home, it's important to adhere to your teaching plan, as no interventions for pneumonia could result in worsening of your symptoms as well as damaging your lungs, which is something we don't want. So it's very important that you understand everything that we talk about, and if you have any questions at the end, please don't hesitate to ask, okay?
Okay. So what interventions will help me get better again?
Okay, so there's various interventions, but the key points that are very important when talking about healing from pneumonia or even acquiring it all depend on the cause, how sick you are, and your overall health. So in my notes, it says that the doctor has prescribed you antibiotics after confirmation of pneumonia from your lab test. Do you have the pills with you?
Oh, yes, I do.
Awesome.
Here it is.
So it's very important that you keep these with you, you don't lose them, because it's important to take the medication for its full course, even when you start to feel better after a couple of days. So it actually says the frequency on the bottle. If the pharmacist or physician hasn't spoken to you about it yet, it says take 2 tablets twice a day for 10 days. So it's important to do that, and if you feel like it's something you're going to forget, or if the label fades or anything, maybe just set an alarm on your phone for every day. Do you think that's something you could do?
Yeah, I actually didn't notice before what the frequency was. So I've actually been taking it wrong. I've been taking my medication for about a day now. Thanks for pointing it out to me.
No problem.
Also, do you think there's any other additional things that I need to know before, to help me heal from this pneumonia?
Sure. So other things that you can focus on, which that's actually a great question that you're asking as well, because there's lots of factors that can go into healing from this. So you want to make sure you get lots of rest, because sleep is important to maintain the progress while you recover from this. You'll need to also increase your fluid intake to about 3 liters per day to stay hydrated, as well as loosen the secretions in your lungs that can accumulate. You also want to eat a well-balanced diet. Even if you may not have an appetite when you're sick, it's also good to keep the caloric value to at least about 1,500 calories to maintain your energy, as well as keep your immune system working well while you're sick. I also have a copy of the Canadian Food Guide here. So this is something you can keep with you or maybe hang in your kitchen. And it basically just outlines the various food groups that you should be implementing on a daily, and it gives a certain amount of everything you should be having. So that's a good thing to refer to, and you can take that home with you.
Oh, thank you.
No problem. So there's also another thing that's actually very important, which includes performing hand hygiene before or after performing an activity. So you just want to rub your hands with warm water, and you want to get both wrists. You want to get underneath your hands, on top of your hands, in between your fingers, your thumbs, as well as your finger beds, your nail beds, and underneath your fingers where bacteria can get stuck very easily, and that's going to help others around you from getting sick, as well as making sure you don't get more sick.
Oh, okay.
Okay, is there any way you can demonstrate that for me?
Sure. So I'm going to rinse my hands under warm water. I'm going to apply soap. I'm going to wash my wrists, on top of my hands, under my hands, in between my fingers, my thumbs, my nail beds, as well as underneath my fingernails, as that's where bacteria can get stuck easily.
Awesome.
And then rinse my hands and get a paper towel to dry them.
Awesome. So there's also another thing you can do if you're not near a sink and you don't have any soap or water. You also want to keep an alcohol-based hand sanitizer with you, maybe in the purse or in your car or anywhere where you think you won't have water or something, soap and water. And you also want to keep a cloth, like a tissue, to cover your nose and mouth when you need to cough or when you're handling respiratory secretions. You want to make sure you give your hands a good clean. So do you have a hand sanitizer at home?
I was actually going to go out after tomorrow when I get discharged and purchase one.
Okay, well I actually brought one right here, so you can take this home with you as well.
Oh, perfect. Thank you so much.
Yeah, so that you also want to rub into your hands in the same duration and way we were doing it before, like when you're washing your hands with soap.
Okay.
And you want to do it for about 15-20 seconds, okay?
Okay, thank you.
Awesome. Do you have any more questions?
Well, I was worried about how this is going to affect my everyday living, especially during my work, which is a pretty stressful, labor-intensive job. So I was wondering if you can give me any advice on that.
Sure. Well, pneumonia requires a lot of rest, sleep to help with progression and healing. And to have an adequate sleeping pattern and have good rest, you want to make sure you decrease any additional stresses you could have in your life. So I think taking some time off of work would be beneficial for the people around you as well as yourself. So if there's anything else you could do, I think that would be a big thing just for your physical health as well as your mental health. Is there anything else you want to ask me?
No, I think I understand now what pneumonia is and how I can prevent the spread of infections to my friends and family from getting it. I know now how to help myself heal from it by taking my full course of medication. I know that I'll bring like tissues with me to cough into to prevent spread of infection, as well as washing my hands for 20 seconds and using an alcohol-based hand sanitizer with me and keeping it for backup. I'll put my food guide up onto my fridge or in my kitchen so that my husband can see it. He's going to be my main caregiver throughout my healing process, and he'll be doing the groceries and cooking. I'll let him know what healthy meals I should be eating. I will make sure to get adequate fluid intake, as well as I will make sure to also
wash your hands.
Yes, wash my hands. And I'll take your advice and take some time off from work because I need to rest, ease my stress from all the stress that I've been experiencing here in this hospital from my appendectomy as well as this newly acquired infection.
Yes, and actually thinking about hand washing, I actually also printed out a 6-step hand washing routine that if you do forget the steps, you can hang it in your washroom.
Perfect.
Yeah, so it's this additional stuff, but I'm very happy to hear that this teaching was helpful and that you have a better understanding of your illness as well about ways to prevent it from spreading to friends and family around you. So the learning base that we were doing today hopefully helps us get the best possible outcomes in your future assessment in 3 to 4 weeks when you come in for your follow-up with your doctor. Hopefully you will have a normal breathing pattern, clear breath sounds, and a normal chest x-ray. And to ensure that the pneumonia is gone, or if there's any additional interventions we need to add to your treatment plan. But if you have any questions before your appointment, don't hesitate to call me, your physician, or the pharmacist if you have any questions regarding the antibiotics or how you're feeling in the next couple of days. So I hope you feel better, and it's great meeting you.
Okay, thank you so much. I'll make sure to attend all my appointments on time, as well as coming to them in the next following weeks. Thank you so much for your time, your help, and your guidance throughout my recovery.
No worries. Thank you.